described in the barbarians and old civilizations. This column X in the Edwin Smith surgical papyrus, which written in hieroglyphics script and describe the spinal cord injury and how to manage with it. Lord Nelson appeared to be the first major figure to have been killed by the gunshot wounds, and also John F. Kennedy, the American president, dead by the spinal cord injury. Spinal cord injury may result in devastating medical and social consequences for patients and their families and community, and may necessitate dependence on support service. This may result from stab injuries or gunshot wounds, resulting in cord damage due to the expulsion injury, vascular damage, and or cord penetrating by the muscles or bony fragment. Epidemiology, penetrating wounds of the spine is the third most common cause of spinal cord injuries. Gunshot and stabbing, 5 to 20%. In general, gunshot wounds with resistant neurosurgical deficit are much more common than stab wounds. Gunshot wounds have their highest incidence in the young males, average reported as 29 years old. Spinal cord gunshot wounds most often occur between 15 and 34. Gunshot injuries to the spine, mostly in the thoracic spine, most devastating in the cervical spine, good result in the lumbar spine. Penetrating spinal cord injuries caused by the stab wounds are rare, but it's very important because it's uncommon, but sometimes want to take decision, special decision, not like the penetrating injuries by gunshot or missiles or expulsions. Such injury might result from a direct lesion of neural elements of the spinal cord infarction, and more rarely intradural or epidural hematoma. Commonly used weapons are knives, screwdrivers, ice spikes, like this in pictures. Energy from a gunshot projectile is directly related to both mass and square of the velocity of the bullet. Ballistic tries to investigate the impact of penetrating injuries by knowing the missile sharpness, velocity, diameter, shape, and the distance from the shooting point. The neurological damage might be different in high velocity missiles and low velocity missiles, in war and civil missiles. Neurological injury can occur even if the projectile does not penetrate the spinal cord directly. The mechanism in which gunshot wounds may cause spinal cord injury: direct injury to the spinal cord, nerve root avulsion leading to intradural hematoma, bleeding, ischemia inside or around cord, heat caused by missile spin, local blast effect, severe infections. The spinal cord injury may caused by the actual falling down after being shot, leading to fracture of vertebra and spinal cord, which is rare by the projectile themselves. A bullet that penetrates into spinal cord might generate additional bone fragment and cause further injury. Transit period of anoxia commonly occur after gunshot wounds of the thorax and neck. Most motor recovery occur within the first 6 months post-injury, with the greatest rate of change occurrence in the first 3 months, and it's rarely to happen later. Spinal disorders can further be differentiated with regard to the affected neural structures as central nervous system or peripheral nervous system in the lower spine. In traumatic spinal cord injury, the main classification is distinguished between paraplegia and tetraplegia, complete or incomplete affection. A further differentiation is made with regard to the completeness of the lesion, complete and incomplete. The ASIA environment scale all allow further grading of the completeness from A to E, complete affection and complete normal. Standard neurological classification of spinal cord injuries like this in paper, very useful to determine the level and how much it caused injury. Syndromes, types of incomplete spinal cord injuries include central cord syndrome, anterior cord syndrome, posterior cord syndrome, and Brown-Sequard syndrome, which is the better prognosis, Brown-Sequard syndrome. These injuries, for the most part, do not always compromise the stability of the spine. Criteria of spinal stability with three-column theory for spinal stability by Dennis was applied to the gunshot injuries of the spine. Unlike the blunt trauma, however, gunshot injuries provide directional force on the static spine and may be less likely to cause instability by itself, even in sometimes two or three column injury if it is partial injury. Complications of penetrating injuries of the spine. Infection, foreign body retained for long-term cerebrospinal fluid leak, cardiovascular complication after acute cord injury, spasticity after spinal cord injury, bone loss and muscle atrophy, bullet toxicity, migratory bullets, spinal epidural hematoma, complications associated with surgical management. Examination, a detailed neurological examination should be done early as possible during the initial evaluation, before intubation or sedation with time and death record. The neurological examination focused to identify level of lesion, the extent of neural compromise. The following clinical symptoms should be distinguished by examiner: motor weakness, sensory deficit, altered reflexes, pain syndromes, autonomic function, bowel and bladder dysfunction, because mostly it gives you the prognosis in long term. Clinical examination, this reflexes to an spinal shock and to determine this compromise. Imaging studies, standard radiographic. In most institutions, interior, posterior, and lateral radiography of plain X-ray is the standard imaging. And it is very helpful and useful to give a good view in your mind to the position of the bullet. This other picture for stab wounds, which also rare, with screwdriver with plain X-ray. CT is the study of the choice, better sensitivity and specificity compared to the standard radiographic. Some believe that initial CT should replace plain radiography in high-risk trauma patients who require screening. These some pictures of CT scans and plain X-ray. Magnetic resonance imaging, MRI, is very useful for soft tissue appearance, especially the cord itself, but the limited of using in metallic fragment in the spine make it it's helpful for non-metallic, as stab wounds, something like wood, glasses in stab injuries. MRI can cause metallic foreign body migration and cause additional neural injury. The ideal goal of surgery can be summarized as improvement the neurological grade, often achievable in some incomplete injuries, avoidance of complications, facilitation of early rehabilitation. Some believe that debridement of muscle tract and removal of bone muscle fragment from the spinal canal is mandatory. Some surgeons believe that visualization of cord help to determine prognosis, surgical decompression of the cord and dural closure with or without duroplasty. The data in the literature are conflict. The aim being not to worsen the neurological state, don't be harmed. The decision to perform surgery depends on four main variables: neurological state, spinal stability, bullet location, and injury levels. The only absolute indication for surgical intervention has been reported to be the presence of a progressive neurological deficit. Other indications for surgery: infection, CSF leak, AV fistula, vascular injury and bleeding, unstable spine, rare pseudomeningocele, disc herniation might be happened after gunshot injury, copper jacketed projectile and lead intoxication, remove an infected foreign body. There is many pharmacological treatment. Tetanus prophylaxis is required, especially an immunized state is unknown. Moreover, broad spectrum antibiotic should be start immediately. Broad spectrum antibiotic covering for at least 7 days, and sometimes 7 to 14 days if the colon injuries is comorbidity with the spinal cord injury. In the penetrating injuries of the spine, corticosteroid controversial, and most of papers take that increase the complications. There is many ongoing trials for penetrating spine injuries, hypothermia, electric stimulation, gene therapy, and bioengineering give many ideas for over the problem of discontinuity of cord cannot be fixed by surgeons and doctors. Pharmacological trials of spinal cord, some riluzole, hyperbaric oxygen treatment, cellular transplantation therapies. The goal strategies differ among the research, with the some aiming to produce new neurons that will integrate into the functional circuit. An important goal of the rehabilitation is the rehabilitation and treatment after spinal cord injury is to improve the function and enhance health-related quality of life. Also, psychological and financial support for victims, as in the time war like this time in Yemen. In our, I will not go to talk in our study with the, I am going to overall the problem. In our study for gunshot specific, because the stab wound injury is very rare, and I use some case reported to complete the.
What? 1 minute, Dr. Mohammed.
Yes, sir. So answer to how handle with penetrating injuries as advice for our colleagues. Pre-hospital spine immobilization is associated with higher mortality in penetrating trauma and should not be to done routinely used in every patient. Sometimes with the hemorrhage or bleeding, covered with the stabilization. Initial treatment should consist of stabilization of patient medical condition, followed by careful neurological examination, because the most important factor for prognosis is the presentation neurological state. 19% of presenting neurological deficit being preeminent. Differentiate hemorrhage from neurogenic shock. This helps to guide the judges of the intravenous fluid. AB and lateral X-ray, CT scan is the study of choice. MRI for non-metallic. Conservative treatment with intravenous broad spectrum antibiotic and tetanus prophylaxis is essential therapy indicated in the patient. Corticosteroid controversial. Nutritional support of the spinal cord injury patient to meet the caloric and nitrogen needs might reduce the deterioration effect of catabolic state. The presence of other life-threatening organs damage have the priority. Might delay the treatment of spinal cord injury itself. The only absolute indication for surgical intervention is the presence of a progressive neurological deficit. With gunshot to the T12 and L5 levels, better motor recovery has been reported after intracanal bullet removal versus non-operative treatment. Stab wounds have a better prognosis, moreover. Surgery plays much larger role. Retained foreign object should be removed after stab injury. Early surgical intervention is therefore recommended in all non-muscles penetrating injuries of spine. Thank you very much. Thank you.
Thank you very much, Dr. Mohammed. I have a very important question. يعني طبعا في وجود الاخوان الجنرال سيرجري والكل يعني. في معنا ديلما كبيره في موضوع الجنشوت، ويعني الكومبليكيشنز حقها او الاوت كم از فيري يعني هوريبل. The penetrating gunshot injury that traversing the spinal cord and perforating the viscus in the abdomen. I mean, the contamination with the stool happened at the same time. طيب, to prevent meningitis, what are the procedures that I can take initially to prevent secondary infection or meningitis? Now I have the bullet traversing the cord, spinal cord, then entering the viscous. So there is يعني contamination 100% and meningitis is coming. يعني I know about 20 cases, all of them died. تقريبا 2 cases اللي عاشوا وكانوا handicapped يعني. But how to prevent?
The contamination mostly not from the bullet itself, because bullet with high temperature not effective, but with clothes, with pieces.
لا من الفيسكس هي يعني transecting السباينال كورد ودخلت في الكولون. في الكولون بالذات لو كان سيجمويد كولون او ريكتم. عباره حصل كونتامينيشن بين الستول والسي اس اف.
more contamination happened in these cases, and you must use good antibiotic and
كلهم we used but no benefit. فانا اعتقد بالنسبه للجنرال سيرجري هل الدايفرتين كولوستومي مانداتوري انيشلي ولا مثلا ممكن تتاجل ولا؟
From the surgical point, you have to do adequate irrigation of the abdominal cavity, do repair or diversion of the intestine, either colostomy or ileostomy, to divert the intestinal content away from the site of the injury, and cover by strong antibiotics, covering gram-negative, gram-positive, and anaerobes, and drainage. That's all. Not in every case. In high velocity, making the severe injury to the rectum or colon, and beside the.
How to decide? Intraoperative?
Intraoperative.
You should decide.
Yes.
As a surgeon.
You have to do debridement, washing, irrigation, and if the colon injury beside the spinal cord, you have to do colostomy away. Thank you.
The priority for other organs damage, sometimes because of the life-threatening. Thank you.
Good.